Last week I got bad news from my doctor. They said that when they tested my vitamin D, that it was low. It was super low. And I was so bummed because it kind of helped find an answer to my problem. But then just this week, we found out vitamin D isn't just important in autoimmune diseases, which is why they were checking mine, but vitamin D is also important for other reasons. It's called a meta-analysis where they combined 3 different studies into one, using the data from 3 different, and combined it all together so they'd have enough to actually get the results that they needed. They'd done a study in the United States, they'd done a study in Finland, and they'd done a study in Japan, but none of them had enough people to actually show whether or not vitamin D helped with diabetes. And when they pooled them all together into a meta-analysis, they were able to show that having a vitamin D level in the right range, taking vitamin D, was helpful in reducing risk for diabetes. So if somebody didn't yet have diabetes, they had pre-diabetes, their A1C is less than 7, and they started taking vitamin D, and they had different doses, different ways of doing it, but if they got their vitamin D blood test level, so mine came back, I think it was 22, and you're supposed to have it at least 30 to 50, and it's best if it's above 50. They showed that those who got the level up, they had the lower risk for vitamin D. So for the people who were above 50, their risk dropped in by like 30%. And for those who, overall, the risk dropped by 15%. And that might not sound like a lot, but if you have 88 million people in the United States who have pre-diabetes right now, who are at risk of progressing from pre-diabetes to full-blown diabetes, needing to take medication, whether it's an injection or a pill, that's huge. That's millions of people who are going to have a less risk of progressing to diabetes. And this matters a ton to people on prednisone because we already know that prednisone is depleting the vitamin D. We already know that prednisone is causing osteoporosis, and therefore we need vitamin D to supplement along with it. And the doctors who prescribe prednisone the most have said you need vitamin D and calcium if you're taking 2.5 milligrams or more per day. So this is huge also for prednisone wearers because prednisone causes prediabetes itself. It causes high blood sugar and can progress to full-blown diabetes on its own. So knowing that vitamin D alone, if you're supplementing while on prednisone, can decrease your risk for progressing to diabetes is fantastic news. I'm so glad they did this research, compiled them all together so that we could know that vitamin D not only helps with your bones, not only helps with your immune system, but now we know that it helps with diabetes. So if you'd like a good high quality form of vitamin D, I just recently made a video talking about the best kind of vitamin D. You should watch that next. Signing off as Dr. Megan, your prednisone pharmacist.